Hello and welcome to this webinar by Qu10 NutriPharma. My name is Ella and I'm the Senior Nutritionist here. Qu10 produces a full range of supplements and today I'm going to be talking about Ubiquinol, which is in the Platinum Excellence range. The Platinum Excellence range consists of high-strength, innovative formulations and/or new ingredients for specific health needs. It has been developed by Qu10 based on the latest research on nutritional supplementation and incorporates industry-leading technology. So each tablet of Ubiquinol Q10 provides 115 milligrams of ubiquinol acetate, and that actually provides 100 milligrams of ubiquinol. It also provides 10 milligrams of vitamin B6. We are recommending this product for energy, everyday health and well-being, and heart and circulation. Ubiquinol Q10 is suitable for vegans. It's gluten-free, wheat-free, dairy-free, GMP quality, manufactured in-house and guaranteed stability. It's highly bioavailable form of coenzyme Q10 as innovative new form which guarantees stability. We're providing 100 milligrams of ubiquinol per tablet and we're recommending 1 to 2 tablets daily with or after a meal. Coenzyme Q10 is found in most living cells and it is synthesized in the body or it can be obtained from the diet. It acts as a coenzyme in the electron transport chain and it is essential for the production of adenosine triphosphate, which drives energy requiring reactions within the cell. Deficiencies occur in elderly, and this is because the biosynthesis decreases with age. The synthesis of coenzyme Q10 actually starts to decrease after the age of 30, and we have a gradual decline until we get elderly. Deficiencies may also occur in people with poor health and poor mitochondrial function. Those on statin medications, HMG-CoA reductase inhibitors, also inhibit the production of coenzyme Q10. And this is because statins snip the pathway that produces cholesterol, but this is also the pathway that produces coenzyme Q10. Coenzyme Q10 exists in 2 forms, and this is as ubiquinone, which is the fully oxidized form, or ubiquinol, which is the reduced form. Ubiquinol represents more than 90% of total coenzyme Q10 in the human plasma. So ubiquinone is the oxidized form. It's stable, but it's not so bioavailable. Ubiquinol is a reduced, unoxidized form, but it's highly unstable. But it's also bioavailable within the body. But then we've got ubiquinol acetate, which is what we're using in ubiquinol Q10. So it's reduced, it's unoxidized form of coenzyme Q10, it's stable, and it's bioavailable within the body. Ubiquinol Q10 contains coenzyme Q10 in the form of ubiquinol acetate, providing the higher bioavailability of ubiquinol, but in a stable acetate form to guarantee effectiveness and shelf life stability. It also contains vitamin B6 to aid in the utilization of coenzyme Q10 in the body. Adequate vitamin B6 is essential for coenzyme Q10 biosynthesis. Lipid-soluble antioxidant, which reduces lipid peroxidation, and it may partially prevent an increase in lipid peroxidation after reported short-term supramaxillary high-intensity exercise. It may help to improve aerobic performance in individuals, Antioxidants help minimize damage to cells caused by additional free radicals generated by an increase in the metabolic activity through exercise. Studies have shown that supplemental coenzyme Q10 may improve exercise capacity when levels are deficient. It has been theorized that chronic fatigue syndrome is due to the malfunction of the mitochondrial membrane and/or a deficiency in coenzyme Q10. 100 milligrams of coenzyme Q10 was given daily. Exercise tolerance more than doubled and all patients had improved. 90% had a reduction or disappearance of clinical symptoms and 85% had a decreased post-exercise. Studies like this are actually really interesting and important as it helps us to help our clients in clinically proven ways. Ubiquinol has shown to have positive effects for reducing blood viscosity and may improve outcomes of ischemic heart disease. The heart muscle needs to make energy at a high rate, as coenzyme Q10 is required for energy production and therefore required in large amounts in the heart. In congestive heart failure, coenzyme Q10 levels decline in the heart as the failure worsens. In one study, 420 patients received either coenzyme Q10, 100 milligrams 3 times daily, or a placebo, and they were reviewed for 2 years. Coenzyme Q10 significantly reduced major adverse cardiovascular events. It may also help to decrease high systolic blood pressure when used long term. Coenzyme Q10 supplementation is recommended by many health practitioners for patients using cholesterol-lowering statin medication. Statin medication lowers coenzyme Q10 levels within the body, and this is thought to contribute to the side effects such as muscle weakness, also known as myopathy, and pain, fatigue, and also an increased risk of cardiovascular disease. For example, one study demonstrated a 40% reduction in muscle pain in statin patients after 30 days of supplementation with 100 milligrams of coenzyme Q10 daily. Investigations have shown that people with diseased gums also tend to have a lower level of coenzyme Q10 than those with healthy gums. And that is because coenzyme Q10 has high antioxidant potential and helps to protect the collagen levels which are needed to keep the gums healthy. A statistically significant improvement in semen parameters, including sperm density and motility, was evident with coenzyme Q10 therapy. Studies suggest that coenzyme Q10 improves sperm quality and may be beneficial to male fertility. Other studies suggest that coenzyme Q10 supplementation can significantly improve fertilization rates. Coenzyme Q10 helps to support energy production of the mitochondria of the sperm cell, which is located in the mid-piece between the head and the tail. This is what powers the sperm cell to reach its destination. Research has shown that ubiquinol acetate has superior pharmacokinetic activity when compared to ubiquinone. One study has demonstrated either ubiquinol acetate or ubiquinone, and the results clearly demonstrate that ubiquinol acetate yields higher concentration of ubiquinol in the plasma. Analysis of plasma levels show that the bioavailability as maximum plasma concentration is approximately 2.5 times higher when CoQ10 is taken as ubiquinol acetate compared to ubiquinone. And here's a nice chart here that demonstrates its efficacy in maximum ubiquinol concentrations within the blood. And here's a chart that demonstrates ubiquinol overall concentrations up to 48 hours. So finally, to conclude, we've got a highly bioavailable coenzyme Q10 product. It's innovative and guarantees stability, and it provides 100 milligrams of ubiquinol per tablet. and it's suitable for vegetarians and vegans, which a lot of coenzyme Q10 products are not. Thank you for listening to the webinar today. If you do have any questions, please contact your account manager. I really hope you enjoy using Ubiquinol Q10 and also recommending it to your customers or clients. Thank you for listening.